Hi everyone, we're on chapter 10 in your book, module 10, following safety and emergency procedures. It's on page 87. Again, your need to know words are here. I'll read you the objectives because I didn't write them in, but we're going to go over accident prevention and defining first aid, um, listing some life-threatening emergencies and what to do for them, and discuss CPR and abdominal thrust. Okay. Um, Okay, so the two most common accidents in the home for the elderly, because we're talking about accident prevention, are falls, number one, and that's in the hospital, that's in skilled nursing, it's in healthcare with elderly, that is number one, and then burns is the second. So first, before we talk about uh, the problem itself, what leads to these accidents? Well, our clients are mostly elderly. And so some of the things that will put them at risk for having an accident, which might not have before they got either sick or elderly, are impaired. There's that word again, impaired, which means decreased eyesight, impaired hearing, decreased hearing. So you can't see, so you trip over a curb. Um, Osteoporosis, so if you do fall and trip, where usually we would get up, you might break a bone, which is fracture a bone, um, decrease muscle strength, and as you get older, you just start losing muscle mass, so you actually have to work out just to keep what you have, not even gain. Um, Hypotension, if the blood pressure is too low, that could cause dizziness. Um, and then hypotension, and then irregular pulses. So if the pulse is irregular, sometimes it brings down the blood pressure. It's really the blood pressure that goes down that makes you dizzy. However, if you're irregular and you have your heartbeat is ba bump, ba bump, long pause, your blood pressure goes down, then ba bump, ba bump. So during those long pauses, the blood pressure could go down just quickly and then come back up. However, that could cause someone to be dizzy. Um, Irregular paralysis, right? If a person is paralyzed, let's say from the waist down, not only can they not move their feet and legs, they don't have feeling there, right? So if something's cutting into them, they don't know unless they actually look at it and see blood coming out. Um, and hemiplegia means they're not totally paralyzed, but they have weakness and they have decreased feeling in the side of the body. And it's usually one side versus from the waist down, it's usually your whole right side or your whole left side. And everybody has different amounts of weakness and decreased feeling, but that would cause you again not to feel something, and of course the weakness causes you to fall. Dementia and confusion. People have accidents because they don't know where they are, they don't realize that something's unsafe. Reduced sense of smell and touch. Again, you don't feel as much, but just think about it, the smell. They can't smell gas leaks, we're unusual smells. And then the side effects from medications. Sometimes it's getting people tired, getting them dizzy, many different ones. Um, so we're with a high risk population, is what I'm saying, that are prone to accidents. So again, these types of emergencies, let's go through the most common ones: falls and burns, poisoning, electrical shock, and choking. And we'll do one at a time. Okay, so, but I think I went backwards. Yes, preventing falls, that's number one, right? So if someone can't move, right? This is someone who's in bed all the time, or they may sit in a chair and they can't get up by themselves. You want to put things that they use all the time next to them, um, uh, so that they're not having to try to get up or reach over too far for them, and then they fall. If you're in someone's home and where you work, keep the pathways clear and no throw rugs because they're prone to trip over the throw rugs. Assist in in the bathrooms and showers, and in the baths and showers, because the floor is wet, right? The shower floor is wet. Make sure handrails are installed. Do you install them? No, but you're going to advise, you are going to definitely tell an agency if you're working in the home, or an assisted living if you're working there, whoever your supervisor is, that you think they need handrails. Now, it's not up to you to tell them, but it's, I always think it's okay to put the suggestion in the ear and say, oh, it might be helpful if there were some good side rails here you could hold on to. Okay, if you're using wheelchairs, always lock the wheelchairs when people are getting in and out of them. Okay, so make sure they're locked. And the same thing, if they have hospital beds, the beds are on wheels. Like the normal beds at home aren't on wheels, but they have a hospital bed and they're getting out of that. Those need to be locked. And you think, oh, why would you unlock them? Well, a lot of times if they're on wheels, you'll unlock them to move equipment into the room or clean under it. So you just have to make sure they're locked. People should always wear non-slip shoes, or at least the non-slip socks. I like shoes or a good slipper so it protects their upper toes too. Wipe up spills, um, good lighting so people know where they're going. And remember, older people usually their eyes don't adjust as well to light and darkness, and so it's better to have good lighting in the house. Clients need to exercise, so part of preventing falls is making sure that they stay in shape and move around. And are they using the walkers, crutches, or canes that they were given? And do they know how to use them? Are they using them correctly? And do they just use them? Make sure they're in their reach so they could use them. And encourage the use of any kind of handrails. And again, the assisted devices, which are what we just talked about, walkers and uh, cane. Okay, poisoning. We may have patients that have dementia or confused. So if you're working in the home, make sure that the medications and cleaning products are locked up. Okay, the other thing is people can't see very well, so assist them with reading the prescription bottles because they may not be able to see them and get them mixed up. Remember, you can't administer medications, but you certainly can read to them. And prevent burns. So one of the things, no smoking in bed if people still smoke cigarettes, and don't let them smoke when they're not fully alert. And I should have put it second, but on the bottom I have here um, one-on-one supervision if smoking cigarettes. So that means we need to supervise them if we're there while they're smoking. Um, One thing, especially if you go into CNA, is make sure you, because this is one of the state tested things, anytime we're using water, we have to test the water first before we wet the patient. So if you're using a basin, I use my elbow and wet the water there. If you're in a shower, you just have to wet part of your arm to make sure it's not too hot. Their skin is thinner, it will burn easier. No heating pads or lamp pads like heating lamps. Be careful if you're at the homes with the stoves. Don't let any of the pots and pans hang out over the arms of them, hang out over the edge. And then if you're serving hot drinks like coffee in the morning or tea, don't fill it to the top of the cup because they may be shaky when they're drinking it. And definitely don't pour it next to them, pour it away from them. Um, if someone does smoke and there's oxygen in use, they cannot smoke if there's oxygen in use. Okay, so no one can smoke. Okay, next is preventing electrical shock. So just be careful when you're plugging things in, make sure that the cords are good, because if not, don't use it. If they're frayed, that means they're frazzled, opening up. Um, if Make sure the area is dry before plugging in equipment. Don't overload circuits, and limit the extension cord use, especially if you're using oxygen. All right, the last one, prevent choking. This was a big one because people, you remember it's muscles that are going down. Your epiglottis is a little flap. Everything when you get older often just doesn't work as good. So we want to make sure so people don't choke. And this is for everyone. However, The person with dysphagia, so I want you to see this word, that means a swallowing disorder. Dysphagia, swallowing, they have trouble swallowing. And just so you know, DYS means less or difficult, and it sounds the same as the word disability, so that DIS has the same sound as DYS, dis, and you can remember because a lot of medical words have come up with dis in front of it, and it means difficulty or less ability. And just like with disability, you have difficulty in some of your abilities. Well, if you see like dysuria would be difficulty urinating or it's painful to urinate. So in this case, dysphagia, the phagia is the swallowing. So, or have difficulty swallowing, that's a word you should know. We want to make sure the patient is mostly 90 degrees, just like I am here sitting. But if they're in a bed that goes up, sometimes you can't get it up 90 degrees. So at least 75, but their head is still up a lot. If they have dentures, put the dentures in. Now, if the dentures don't fit right, then that might not be good either. So only if they fit right. Cut the food up in small bites. Encourage them to eat slowly, chew well, take small bites. Don't ask them questions while they're eating. That's not to say they can't talk while they're eating, but talking and eating don't go together. Um, you have to swallow, then talk. Okay. If someone does have this, now those are for everyone, but if someone has dysphagia, we might have to thicken up liquids. So they find a thicker, so instead of having water, just plain water, how thin it is, you would put a thickener in it. It's really like a cornstarch, but it makes it thicker and it's easier for the mouth to control it and for it to swallow down in one big bolus and go down the right track, which is in the esophagus. Another thing we teach people with, and it doesn't happen all the time, but is to tuck the head down when they're eating, okay? Not up. So it's just if you try to swallow, tuck your head down now and try to swallow. Now put your head back and try to swallow. It's a lot harder when it's back like that because that's opening up your airway versus closing your, we want our epiglottis to close so we could swallow. Okay. Okay, so that's it for the main emergencies, but these are to prevent emergencies. Here is, and I'm over this person, any oxygen, no smoking. So this is someone in the home. This is called an oxygen concentrator. So it's a machine that sucks in the air, and room air, the air you're breathing, is 21% oxygen, and it concentrates it to, I don't know if it's 100%, but a much more concentrated percent. And then this person, and you can barely see it, is wearing this nasal cannulas. So again, no smoking, nobody in that room. And here's a better picture where you could just see how that's, because this is the most common one when it's under the nose, around the ears. Okay, but no smoking cigarettes, nothing that could spark next to that. So like electrical stuff like razor, sometimes shavers spark, so the electric ones. Okay, now to prevent, in case of a fire, what do we do in disasters of fire? So we want to learn the acronym RACE. So the word acronym you don't have to remember, but that's just when we put together some words and make it somehow we can remember it. And in this case, they're doing the first letter of each word and making another word out of it, race. So the R stands for rescue. So we're going to rescue the person, get them out of that room. We're going to pull an alarm. Now, if we're not in a facility with an alarm, then let's call 911, right? Because the alarms would call 911. And then we want to contain the fire. So we want to close the doors and windows and not let more oxygen in. Oxygen feeds the fire. And then if we have a fire extinguisher, and it's a small fire, so maybe in a garbage can, something like that, we're going to extinguish it. Use the fire extinguisher. So if you're doing home care, you should know where that fire extinguisher is, or even if they have one. And if we don't have an extinguisher, we're going to exit. So every house, and that depends on, see if your agency, do they request them to have a fire extinguisher? Because some may do that because it's a safety thing. And you can buy them at Home Depot. Okay, if you have a fire extinguisher, and I don't have a picture here, but there's one in your book, there's another acronym, PASS, and that means pull the pin, aim it at the base of a fire, squeeze the handle, and sweep back and forth. So I don't have a picture here, but there's a video that you need to watch, and there's a few questions for both race and PASS, and it's actually part of UCSD's training. So it is in a hospital, but it has good pictures. Okay, the um, the next part of being prepared is to prepare for catastrophes. So with the CNA class, when we go into a skilled nursing facility, we have to look at the exits for evacuation. So how the heck you can get out, front door, back door, if you're in a house, side door, windows. Where is the fire extinguisher, and where is the main gas turnoff? I mean, we all should know that in our apartment or our house. Um, Okay, and if you're going to a house, you should know where those things are. Um, okay, if you're in someone's house working through a home care agency, we should have the emergency numbers posted by the phone. So for us, for emergencies, it's 911, but maybe there's other ones like you want your agency number or have it in your phone. The doctor's number for them, because it may be the caregiver or their family could call the doctors. And we could say, hey, you should have these lists, and the agency phone number. Um, where are the fire exits when you're in the home? Um, and should that client have an emergency call bracelet or necklace, a Medi alert, right? So that they could call 911. Just things to think about. Uh, since we are in California, you better know the earthquake. Drop, cover, and hold on to something, right? So you're going to drop to your knees so you don't fall down. Try to get under something and then hold on. And here's links if you want to see. There's videos in here. First aid. We have to know that we can give first aid. So that's an emergency situation, right? And the life-threatening emergencies are the priority. Priority. Is the person breathing? Did they have a cardiac arrest? Are they bleeding out? Head injuries and shock. So before we go into that, one position you need to know is when you're done, because your book has, I'm doing it in order of the book, when you're done, like with CPR or somebody having a shocky condition, we want to put them in the recovery position. So this picture is someone who's giving CPR, and now she's going to turn them. They're living, or they're doing, maybe she did just mouth to mouth. She's going to put the one arm up. This is a great way to turn people, right? She's on the floor, and then she's going to cross the other arm over here, and then by the she's picking up the knee and she's turning the person over towards her, right? And then you could even put their arm underneath their head so it's on their hand. And she is so the person's like this, right? And she's able to view his face. And this way, oops, if the person vomits, they won't aspirate. And that means if they vomit, they won't suck in their vomit into their lungs. Aspirate is when something goes into your lungs other than air, right? If it's some foreign material, could be vomit, could be food. It helps promote the breathing, and you want them to turn towards you, because if you look this up, sometimes they're turning the person away from them, and it should be turned towards you so you could visualize their face. Okay, next one, shock. People go into shock, and that's a very low blood pressure, right? So low, what it's caused by, you could have an anaphylactic shock. That would be like you're having a allergic reaction. You could have a cardiogenic shock where your heart isn't working right. You could be in shock from almost being in an accident, right? Your blood vessels just ease out. And so your blood pressure drops. So think of it as we want, so the main, what can happen is they have nausea, vomiting, their skin is pale, cool and clammy, just means they're cool, but they're sweaty, but they're not hot. They're breathing shallow. You feel their pulse, it's rapid. They may become unconscious. So, um, okay, the treatment for shock is you want to lay the person down flat, elevate the legs above the heart level. That brings a lot of blood back to this area into the brain. Keep them warm, reassure them, loosen up their tight clothing, just it'll make them feel better, help circulation. Of course, start CPR if you have to, but this is amazing how it increases the heart blood pressure. So even if someone was faint, feeling dizzy, lay them down, put their legs up, they'll feel better. If someone is choking, then we're going to do abdominal thrusts, and there's videos in the modules, but I just want to show you with your hand. You go over your abdomen, a little above your belly button, and you're going to go up and in around someone else's body. Now, you could do it to yourself. Let's say you were choking, you could do that, right? And that would help because you're trying to push that diaphragm up and push the air out and whatever foreign object is in there. Someone is pregnant, you would go and just do it on their chest because whatever's stuck is stuck from here to here. So then we do it on their chest. Or if the person is too big in the abdomen, you could still do it on their chest. And you'll have to watch the video for that. CPR, if you have to do CPR on someone. And CPR is cardiopulmonary resuscitation. It's in your book. And there's a video so you can watch it, but there's another acronym, CAB. And first we're going to do the circulation. So we pump for the person and then we give them, open their airway and give them breathing. So when it's an adult, it's usually because of heart problems. Now, with children, that's a different story, but we're working with adults. But with children, it's usually because, or at least infants, that they got something in their mouth and it went down the wrong track. Okay, I just there we added heat stroke prevention, right? Because we're so hot here in California. And remember, the warning signs are when your skin is not even sweating anymore. It's just red hot and dry. Start getting a headache, start getting a strong you're dizzy, nausea. And really it happens here. We've heard people hiking and getting heat stroke. So make sure you have fluid, and it is a big concern. Um, get out of that sun. And then seizures. Um, if someone has a seizure, we want to protect them from injury. We can't do a darn thing for them, right? Just wait till the seizure's over. We pad things around them, so they don't hit their head on something hard. So if they went on the floor, we might try to slide a jacket under them or a pillow just so they don't hit their head. And that's when someone starts moving like this and they don't even know what's going on at that point. Never put anything in their mouth. That was done, and sometimes things are done wrong in the medical field, and at least we don't do it anymore. Once they're done, check their airway, and then that recovery position, we're going to put them in that position because they may drool as they're waking up. We don't want them to aspirate. Okay, and here's another link if you wanted to look for, and this is more mental health, and I'll put those in the modules. Thank you.